As we age, everyone sort of develops arthritic change, and one of the elements to that is that we tend to lose space available for the nerves in our spinal canal, and if that starts to cause symptoms for a patient, that's where we try conservative treatment, and if that's not doing enough, that's where surgical management becomes part of the algorithm. The most common symptoms for having a pinched nerve would be radiating pain down an arm or a leg. If it's pretty severe and involving the central portion of the canal, oftentimes you start seeing other symptoms involved where it can be in both legs. People can start complaining that they have trouble walking long distance without needing to lean forward on something, and that's when we refer to it as stenosis with claudication, meaning trouble walking long distance. I run a very conservative practice, so most of my patients before we're really considering surgery have often tried some physical therapy, have tried at least a few medications, and then often we're trying an injection or two before surgery as well to see if we can alleviate symptoms, as those are certainly less invasive than even the most minimally invasive surgery. To perform a minimally invasive decompression, we use a specialized retractor called a tubular retractor, and that allows us to dilate apart the muscle fibers so that we don't have to cut muscle off of bone. Whereas the more traditional decompression, which is sometimes still necessary, in that procedure you actually have to peel the muscle off the bone, and that tends to lead to a little bit more pain in the early period. So in my practice, I try to do the minimally invasive if that's an option for folks. In a minimally invasive decompression, depending on how many levels of the spine we are addressing, most folks can go home the same day after that sort of surgery, and that's similar for an open or more traditional decompression as well, but the minimally invasive patients tend to have less pain in the early recovery period, which I think works to their benefit.